This new FDA ruling is expected to have a positive impact on many heart patients. The transcatheter aortic valve implantation was only available for high-risk patients, allowing them to avoid open heart surgery. Well, this FDA ruling, it now allows the device for low-risk patients as well. And Dr. Michael Lim, cardiologist with SLUCare and SSM Health, St. Louis University Hospital, joins me with how the device works. And it is absolutely fascinating when you see this digital representation. This is a game changer, isn't it?
Aortic valve replacement without surgery is a complete game changer.
Yeah.
And as you alluded beforehand, we had to sort of pick and choose for patients. And now, based on patient choice, they get to understand the benefits of open heart surgery, which has been around for a long time and a great way to replace your aortic valve. Or most of the time go through the leg with a catheter and put a new valve in, pushing the old one out of the way, leaving you a new heart valve without any large incisions, prolonged hospital stay, open heart surgery.
It's absolutely fascinating because it just pushes, like you said, the old valve out of the way and then takes over.
So the new valve is in a metal cage. There's a few different versions of it, and that metal cage gives it its support. That metal cage pushes the old valve off to the side, and there's a new tissue valve inside that metal cage which starts working instantaneously. So we affect how that patient's doing within a few seconds.
Since this FDA ruling, has that increased the number of, they call it TAVR procedures that you have been performing?
Not exponentially, but it's going to go up. And I think the beautiful thing about this is now the decision is in the hands of the patient. So the patient really has the onus on them to seek out and say, what is my best surgical option here, and what is the catheter-based option good for me for or not good for me for, and they get to help make that decision.
I'm just curious why it is that only the high-risk patients were able to receive this, and now it's open to everybody else. You would think that something like this would immediately be open to everybody.
You would, but the problem is you want to actually prove that it really works. And so the FDA's mantra is safe and effective. And so what they say is, okay, you got a new technology, go ahead and test it. And so it was tested against the hardest of the hard patients. So it started with surgical inoperable patients, patients who could not get surgery, and then gradually moved down to high-risk surgery patients, intermediate-risk surgery patients, and then low-risk surgery patients. And it had to be proved each step of the way that the catheter valve was at least as good, if not better, than surgery. And it was proven on each one of those steps. And that's what the FDA just followed. Says the evidence says it's just as good.
Let's get it done.
Okay, let's do it.
That's great. Well, it starts now. Thank you so much for coming in, Dr.
My pleasure.
We appreciate it. All right, you know, Timmy's a little bit on the crazy side.
Yeah.
He's at the Pep Zone this morning.